Like I said, I saw changes, reduced number of plans, higher out of pocket for a lot of people in 24. I think that's going to be even more accentuated in 2025.
Hey everybody, with me today is sort of an old friend, I should say a repeat person on our podcast. So with me is Jon Ebersole from his company, Medicare Madness. We work with Jon a lot with clients. Some of you may have met him and be working with him now. If you're not, you probably should. Jon works with a lot of Medicare patients. How many folks do you think you work with right now?
Right now, I'm about at 1,800.
1,800, right? A lot of that's done telephonically or over the internet?
Yeah, video, phone calls, a lot of in-person as well. So whatever people are comfortable doing.
And you know what, Jon, I probably said this to some others before, but what I like about folks that I know that sit down with you is they always usually give us feedback, and it's usually, oh, he's so laid back, and he made it really complex into something real simple, and they just felt confident. So congratulations to you.
Thank you.
But the reason I wanted to get you in here, and I asked you, and I appreciate you taking time to come in, is, we're just getting into 2024, got through, I'm sure, a fun, busy season.
Yes.
But as we head into the next season, there's always bells and whistles and changes and things like that to look for. So would you mind dropping some knowledge on us today and just kind of filling us in on what some of those main things are that people should focus on? I know you could probably talk for an hour, but let's try to do it in like 5 to 10 minutes.
Yeah. Well, thanks for having me, Bob. It's always fun to come on your podcast.
Is it fun?
Yeah, it is.
Good. Some people get like all tense about it, but good.
No, you guys do a great job. So
thanks.
Well, yeah, there's actually some really big changes that are happening in 2024 and 2025 for the Medicare Part D. That's the prescription drug program.
Okay.
And the Part D program is kind of notorious for being the most confusing part about Medicare.
Right.
So hopefully it's a little simpler for people, the changes that are happening. So
is that real? They always say it'll be better, but hopefully.
We'll see how it shakes out. So for the past 10 years, the past decade, the plans have always worked kind of the same way.
Okay.
And the plans work much differently than someone would have had through an employer plan. So it's always kind of a big shock when people come into Medicare, especially if they're taking prescriptions that are on the more expensive side.
Okay.
So previously, the setup was there were 3 different coverage levels within the Part D drug plans. So you start out, they always run from January through December, so they're calendar year plans. So whenever somebody started, it could be January 1st, they could be turning 65 or retiring and go in mid-year.
Right.
But whenever they started in what's called the initial coverage level.
Okay.
So that's where you start. Typically, there's a deductible with the Part D plans, and then there's typically 5 tiers, and each drug plan has their own copay or co-insurance for each tier.
It sounds really simple.
Sounds good. Yes. And there typically used to be around 30 different drug plans.
Right.
Now we're down to 20 or 21 for this year in 24. So people would start in the initial coverage level. Again, they'd be paying toward that deductible or a copay or co-insurance for their prescription. Then every time they filled a medication, the plans kept a running tally of the total retail cost of that prescription that they filled through the drug plan. So that's the total retail cost is made up of what the patient or the individual paid and what the drug plan paid.
All right.
So that total amount, the drug plan kept a running tally of that. If that amount went over $5,030, that's the limit for 2024, they went into the second phase of the Part D plans, which is called the Part D donut hole.
Yep.
So if this is kind of notorious, the Part D donut hole.
Right.
Typically, people's out-of-pocket will go up when they go into the donut hole because they start paying a 25% co-insurance for a drug they may have been paying just a small copay for when they're in the initial coverage level.
That's where they usually go and turn around and look at the person at the pharmacy and go, wait a minute, I think you made a mistake.
Or I'll get a call, why did my costs go from $47 up to a couple $100?
Yeah.
And obviously you can prep people as much as possible, but it doesn't always stick until they are actually at the pharmacy.
Yeah, when they feel the pain.
Prescription.
Yeah. Right, yeah, absolutely. let's just note that we have folks working in offices above us. So if you hear people walking on the roof, on the ceiling up above, we have a whole office filled with people rocking and rolling. But sorry, keep going.
All right. So we have the initial coverage level.
Yep.
Then someone might go into the Part D donut hole if their costs go over the threshold.
Yep.
And then there was a third level called catastrophic coverage. So once they call it your true out-of-pocket annual drug cost exceeded for this year, it's $8,000. Then previously you had to pay a 5% coinsurance. So your cost went from 25% down to 5%, but you still were paying that 5% through the end of the calendar year.
Mm-hmm.
Then you start January 1st, everything reset back to square one, and you started over.
Right.
So for people that were on really high cost prescriptions, different biologics, specialty drugs like Humira is a pretty well-known drug, that can be $5,000 to $7,000 a month retail cost. So people were spending around $6,000 to $7,000 out of their pocket just for Humira, when they went through those three different levels. So in 2024, the Medicare Part D plans were changed. So now there's really only two different coverage levels. So you have the initial coverage level, and then you have the Part D donut hole. If someone reaches that third level of catastrophic coverage, they're now going to have no out-of-pocket the rest of the calendar year in 2024.
You can really, I guess I would say you could really budget. If you know your medicines already that you plan on continuing into the next year, you can really budget because you know your cap.
Correct. Yeah. So, and I have a quoting tool where I can show people an estimated out-of-pocket cost.
Gotcha.
But not having that third level 5% go away, or having that 5% go away.
Yeah.
Now it's really cut people's costs pretty much in half. So that person on Humira that spent $6,000 to $7,000 out of pocket, now they're down to $3,000 to $4,000.
Well, that is exciting.
So that's a big savings.
Yeah.
And there's even a bigger change coming in 2025. So in 2025, they're putting in it's a $2,000 max out of pocket on all the drug plans. So no matter what plan you select, the most you're going to pay out of your pocket for the year is $2,000. So now that person spending $3,000 to $4,000 is only going to spend $2,000.
Interesting.
So that's great news for
great news.
People that have high cost prescriptions.
Right.
The potential downside.
Here it is. Yeah, that's okay.
There's always a give and take.
Yeah, absolutely.
So again, this is really going to help people that have high cost prescriptions. I actually went through my whole client list to see how many people actually spent more than $2,000 out of their pocket. So the people that would save money on this $2,000 max.
Mm-hmm.
And it came out to about 10 to 15% of people.
Okay.
So it's going to help, 10
Some.
to 15%.
Okay.
The remaining, 85
are going to pay for it.
are going to pay for it, unfortunately.
That's less exciting, John.
Yeah. So the number.
I know you don't make the rules, but I appreciate you putting in that perspective. So go on. I want to hear more about this.
So the potential impacts that we're already seeing in 24, and I think will even be more impactful in 2025. The number of plans are being reduced. So there were a couple carriers that just threw up their hands and said, we can't keep taking on this additional cost. We can't do a profitable business. So the number of plans that were available dropped.
So you said originally it was 30-ish.
30
down to
went down to
20-ish?
26. Next year there's 20.
20, okay.
Yeah. So, and it can depend on your area. But so now that the number of plans that you have to select from have been reduced. And for people that are on less costly prescriptions where they're kind of under that $2,000 max, they're going to get there quicker. So they're going to spend more out of pocket quicker. So for example, typically a lot of plans for a tier 3 drug, so it might be a brand, costs $500 a month. They would spend a $47 copay for that prescription until they hit the donut hole. So they were good for about 6-7 months.
Right.
And then they'd start hitting the donut hole and their costs would go up. Now, most plans, instead of having a set copay for a tier 3, are having a co-insurance. So it's almost like they're in the donut hole
Out of the gates.
starting
Yep.
January 1st.
Okay.
So, and to buy a plan that has a set copay, you're paying $70 to $80 a month to get that. So usually it doesn't make sense.
Okay.
So the people under that, that 10, 15% that are being helped are paying more out of their pocket quicker earlier in the year. So
Gotcha.
that's
So,
great
yeah.
news for some people.
It is, yeah.
Not quite as good news for others.
I mean, I think anything with regards to government spending, right? You're going to have some winners on one side of it and some
yeah. And
less than winners.
And the key is, trying to figure out which plan's going to be your lowest out of pocket.
Right.
And when I work with clients, I always ask for an update on their prescription drugs, once we're getting toward the open enrollment period. And then when I calculate all the plans next year, I can see what their projected out of pocket is going to be. So
That's nice.
it's important for people to get me those updates when I reach out for those, so I can get an accurate projection for them. And again, there's still, quite a few plans available that you can try to move around within and try to get your lowest cost. But
yeah, I've always admired that about the way you do that, because 1,800 clients is a lot, right? And you're adding to that because,
Yes.
I know we send some folks your way and they come back, very happy. And I just think that's why you've grown to such a size, because you're doing a great job. But having the ability to plan out and be proactive throughout the year versus everybody just waiting for those couple of months at the end makes a big difference. It makes it a lot easier for you. It's probably better for them too, right? Because we're all getting these stacks of advertisements and stuff, and they just I got it taken care of. That's a good feeling. I can't tell you the amount of really intelligent people that would come to me having, retired from these amazing careers that say that stack of papers intimidates the heck out of them. And I'm like, you used to do like highly intense math kind of work. I know, but I hate it. I just hate going through all that stuff.
Well, I've even worked with physicians and they're like, I have no clue what this is about.
Really? Yeah. There's a great example.
Because it's totally different working with medicine versus Medicare insurance.
Yeah. Although I'm pretty sure they have a pretty strong bias against or for certain parts of that you go through.
Typically, yes. Yeah.
What about anything else that stands out to you as something that folks should know as we head through this year? That was a great update. I don't know if there's anything else going on. I mean, you could probably talk for hours and hours, but
yeah, that's the big update, are the changes coming over the next 2 years. Like I said, I saw changes, reduced number of plans, higher out of pocket for a lot of people in 24. I think that's going to be even more accentuated in 2025. So it's going to be an interesting open enrollment coming up this year.
It's weird. And now that I think about it, like you keep referring to 2024 as if it was in the past, but you just set everybody up for 2024.
You're always looking ahead.
Yeah, I forgot about that.
Always have to plan for that.
I was going to correct you a few minutes ago. I was like, no, I think I know what he's talking about there. Okay, that makes sense. How does somebody reach out to you if they want to get in touch with you?
So they can call me. My phone number is 717-798-1603. And it's obviously not a 570 zip code. Moved here a few years ago from the Lancaster area. So
and you're working with people all over the place.
Work with the people all over. Yeah, I'm licensed in over 17 states.
Okay. So. And Jon, is there a specific time? Like a lot of folks always, if they're turning 65, best time for them to reach out to you? 3
months in advance is ideal. So we can get a good base, make sure they know what they have to do, especially if they're working past 65. There's certain forms they need to get from their employer to show they had credible coverage.
Gotcha.
So I help get those forms to them so they have everything they need and show them how to file it and do all that. So I mentioned my phone number, email, jon@medicaremadness.com. Email is a good way for me to be able to reach out to you outside of normal business hours.
Yeah. And your website's great too, medicaremadness.com.
Yes.
And there's all that contact info there. What about somebody who has never used you but has been on Medicare, but they kind of want you to take a look at things? When's the best time for them to reach out?
Yeah, a month or two before the annual enrollment period starts, so August, September.
Okay. The answer is always now.
Yes. Reach out to me now, and we can start planning for the annual enrollment period.
Yeah, that's great. And you, like I said earlier, you meet people in person, obviously, but a lot of it's done over the phone or a video.
Yeah, whatever most convenient for them. And I'd use Zoom a lot, so I can share my screen and show them, all the different plans and go through all that with them.
Isn't it amazing? Just like a handful of years ago, like no one even heard of Zoom. Now everybody's like, oh yeah, Zoom, FaceTime, whatever it is.
2020
Teams.
changed everything.
There's some good that came out of it, but
yeah.
This has been great. Anything else? Did I miss anything, or did you forget to say?
No, I think that's gonna fill up your 10 minutes that you wanted to fill. So
yeah, no, that's perfect. And like I said, it's just an update. We love what you do for our clients, and there's a lot of folks out there that need guidance on it. And this is my last minute plug. I want to say, I have a big issue when I'm watching TV and I see some of the ads that come out.
Yes.
You and I have talked about this on the side, and I think it's a crime, in my opinion, and unethical the way they do some of these commercials, especially when they make elderly folks look dumb. I have a real big issue with that, and I think we've talked about that one where the lady's acting like she can't. It's embarrassing, and I'm surprised that they allowed that. The TV ads, whoever's putting that marketing together, allows that to go out, because I think everybody should be treated with respect, whether they need more help or less. It doesn't make sense to me. I know you didn't plan on going off on that tangent, but I love that you treat people with respect, and that's all the feedback I get. So I just think people should know that.
Well, Medicare has to review any advertisement, written or verbal, or anything that goes out. And like you said, I'm surprised they allow that. I mean, it's almost predatory.
Yeah.
And I've had people that called one of those numbers just thinking, oh, well, maybe there's an extra benefit that I'm not getting, and they switch their plan on them without their consent.
Yeah. I
mean, I wish those would go away for sure.
I don't want to end it on a down note. No. But we'll keep the predatory folks out there away from us. And I really appreciate your help, Jon. I appreciate you taking a couple minutes today and coming in.
Yeah,
and
always a pleasure.
Probably ask you to come in again.
Sounds good.
For the next changes. All right. Thank you.
Thanks, Bob.